Hi, welcome to Local Matters. We have a show today where we're going to talk about a vital part of our community, so it's good you're here. I have with me today Peter Hofstetter from the Willamette Valley Medical Center, the CEO, and thanks for being here.
Gosh, thanks for having me. Pleasure to be here.
Well, I came to you 6 months ago and said, would you be on the show? And we had to wait this long to get you in, and I'm so glad that we've got a hospital so close.
Well, we're glad to be here.
Where would we be without our hospital? So what's going on over there? What's new? What's top of your list of projects?
Well, there's quite a list. I think the good news is it's for the most part all good news. I think a couple of things. We just finished this year. All hospitals are required to be what they call accredited, and we finished our accreditation survey this spring and had a very strong and successful survey, and we're actually certified with distinction. And we are now one of 117 hospitals in the United States that have had distinguished certification for 5 years in a row. So we're pretty excited about that. And frankly, it's a tribute to the doctors and the employees and all the hard work they're doing and the good things they're doing to take care of patients.
Well, Peter, we've heard some good things just right here in the studio. One of our cameramen, Richard Regal, was saying in the past years he's been going there, he's noticed a great improvement in customer service. So tell us about maybe what's been going on around that.
Sure. It's always great to hear that feedback. And our employees have been working really hard to really work on how we greet people, how we treat people. This day and age, people are really interested in trying to get in and out quickly. And, we're sort of in this generation of, cell phones and everything that move quickly, and can healthcare move quickly as well. So our employees have worked really hard to make sure we're talking to people, we're listening, to make sure that we're prompt, we're friendly, we do things correctly. So it's really good news to hear that, and we're working very hard at all of those activities.
Now, the population is growing here, and the hospital is growing to keep up. Tell us about, are you recruiting? Are you shrinking? What's going on?
Oh, no, we're recruiting. It's an interesting conversation, physician recruiting. I think that in Oregon in particular, there's a number of states that were what we call Medicaid expansion states as part of the Affordable Care Act or Obamacare. So we've seen a large increase in people that have insurance and that are looking for physicians. And so what we call primary care physicians, internal medicine, family practice, pediatricians, there's a national shortage. The good news for our area is we've been successful in recruiting. I would say we're in good shape, not great shape. It's still difficult to get an appointment, but so we're always looking for new primary care doctors. We have a husband and wife couple that will be joining us. I think it's in August this year with West Hills Family Practice. We brought on 2 pediatricians last year that joined the PMC group. We have an interview actually with another internist for our own McMinnville internal medicine practice. So anytime we get an interest from folks that want to come to this area, we'll jump on it, because primary care you can never have enough of. We are bringing a 4th general surgeon on. He'll be joining us probably before school starts. They have children that they need to get in school, so probably August, early September. We brought on 2 new OBGYNs in the last year. We're going to bring on a 3rd one. They'll be joining existing practices this year. We're talking to a couple of orthopedic surgeons potentially to bring on. So we're excited. We've added, the emergency room group has added 2 new physicians to their group. So there's lots of exciting stuff happening with physician recruiting.
The emergency room, there's 2 ways into the hospital. There's one through the front door. You have an appointment, I guess, with a doctor.
Right.
There's several doctors there. Or you go in through the side door, the emergency room.
Right.
And that's been something that's been in the news a lot. People are treating the emergency room like they don't have a primary care doctor, so they go there. That drives expenses up. Tell us about what's going on around that.
Sure. I thought you were going to make a gallows humor joke and talk about how else you could get to the hospital on a
Oh.
stretcher, but
Oh.
we won't go there. No, the emergency room, it's a bit of a catch-22. We're there 24/7. The idea is if you ever have a real serious emergency, car accident, heart attack, get drastically ill or something, and that's what you want for an emergency room, and that's what we're geared up for. And as you pointed out, unfortunately, a lot of people use the emergency room as their primary care doctor, and that happens really for a couple of reasons. One, they can't get an appointment, or because we're there 24/7, it's really convenient. You don't feel good, you get in the car or have somebody drop you off. What we're looking at, or what we've started, it's almost a year now, I guess, is what we call a fast track. And so certain hours during the week, Monday through Friday, we run a sort of a separate clinic within the emergency room. It's run by nurse practitioners, and you'll come to the emergency room waiting area, you'll register, and the triage nurse will interview you and then decide, is this a serious emergency or is this something that can be taken care of in a faster, more expedient way? And the vast majority of people that come to the emergency room can be treated that way. And so the idea is that you can get in and out quicker. We've probably knocked a good 45 or 50 minutes off a visit, and it's less expensive because generally you're not getting the same number of tests that you would in the emergency room, and you're seeing a nurse practitioner, which will bill out a little bit less than a physician. So it's not horribly inexpensive, but it's not as bad as going to the emergency room. So
this is a bit of innovation. Is this?
Well, I think it's innovation, but it's probably just adapting to what the environment requires. So.
Well, we're happy to have this hospital so close to us, such a great part of our community. And I know that you've been reaching out into the community,
right,
to kind of have more of a presence in town. Tell us about what's going on there.
Sure. We've really made an effort the last few years to get out and about, if you will, sort of get out of our own four walls. There's a number of our managers that are involved in a lot of the local not-for-profit organizations. We sit on things like the Chamber. We sit on the YCCO, the Medicaid, local Medicaid Agency Board. We sit on Henderson House, Juliet's House, lots of church and Boy Scout, Girl Scout types of organizations. So we've really tried to encourage our employees, our managers, to get out and about and do those things. We've also participated financially with a number of those organizations. As you know, there's always a fundraising effort for something, and we've tried to participate in a number of those, and sometimes it's just buying a table at they'll have an auction or those kinds of things. So we've done a lot of that. We've contributed diapers to the Family Place, Lutheran Family Services. We've been contributing food, bulk food to YCAP. So we're excited about that. We actually met with St. Barnabas, and we're talking about, because we have to work within health department rules and regulations, but when we have leftover food, can we donate that to them as well? So we're trying to work out a process to be able to do that as well. And what I understand is I think it's Thursdays or the one day a week that there isn't food available, for the homeless community and stuff, or the needy. So we're trying to figure out if we can do something that way as well. So we're trying to get out and about.
Thank you.
Sure.
Yeah. Corporate citizen is the word. Let's talk a little bit more about the nature of our hospital here. It's a for-profit hospital.
Right.
Over in Newburgh, we have a not-for-profit
Right.
hospital. Things have changed recently, though, with the expanded Medicare. The fortunes of the hospitals have improved. And tell us a little bit about how the nonprofit and the profit
Sure.
model are different, and maybe what adjustments are coming.
Sure, glad to talk about that. We are one of, in this state, two not-for-profit hospitals, us and Willamette. The other hospitals are all not-for-profit. We all fundamentally do exactly the same thing every day. We see patients, we see them in the same way, we treat them the same way. The difference between the two organizations is not-for-profit hospitals don't pay taxes, for-profit hospitals pay taxes. In our case, we pay almost $1 million a year in property taxes, just like you do for your home or your business, and that goes essentially to the city of McMinnville. The corporation pays some taxes to the state of Oregon, and then we, of course, pay federal taxes and all of those things. Not-for-profits don't pay any of those taxes.
For example, when there's a bond measure here and we voted to pave the streets,
right?
You're participating in that.
We're chipping in our fair share. I think the bond issue, and I can't remember, it was passed right after I got here. I think it was a year ago or so.
Yeah.
And I think our annual contribution is like $60,000. It's whatever is assessed on your property tax bill, and we pay that. So, yeah, I think that it's important. And some people, I've read some of the articles. Some people get nervous about being a for-profit, and I think. I would consider ourselves very good citizens. We employ a little over 600 people, the vast majority of who live in this community or live in Yamhill County, buy houses, pay rent, buy goods and services, pay taxes. And then the hospital itself, we pay taxes, property taxes. So I think we're doing, I would argue, not to be negative or positive, but I would argue we're doing more than certainly the not-for-profits in that respect. It's an interesting conversation right now because on the state level, the whole profitability of hospitals, as you mentioned, is being reviewed fairly energetically.
So you're getting more people with insurance coming, whereas before they would come without insurance or without a way to pay. So you would be writing off losses that way. Now they're paying, you said maybe not completely, but there's a fraction. What you quoted a fraction of?
Yeah, every hospital's paid a little bit different. It's, because we all have different formulas with the state, but basically you're getting 30 cents or so on the dollar from Medicaid. And as you pointed out, the good news is you're not getting zero, you're getting 30, so it's better than it was. This gets into the whole conversation of how healthcare is funded by the federal government, which is probably a subject for a whole nother conversation. But
we've got 10 minutes. Let's do it.
10 minutes. But the good news is for the the vast majority of the hospitals in Oregon, by being an expansion state, we've all seen significant numbers of new patients that now have insurance. And so consequently, your charity care has gone down. There's more people with insurance, so you're just writing off less. Some of the smaller rural hospitals, in all fairness, in some of the eastern parts of the state, are still, struggling. Rural hospitals, having run rural hospitals, it's a very difficult job. So, but for the most part, the hospitals are doing better given the expansion of Medicaid. And the good news is more people are covered with insurance, which is really what ultimately you want to do. And they have access to health care, health providers, those kinds of things.
The article in Willamette Week you were talking about where the hospital had $6 billion in the bank, a not-for-profit.
Right.
And so that had some people scratching their head on, this is a new climate here.
Right.
And maybe this exemption on taxes needs to be looked at.
Yeah, the Willamette Weekly did a report. It's been 3 weeks ago, and they sort of looked at the profitability of hospitals. Everything we do is public knowledge. I mean, we have so much, we are so highly regulated and so much reporting. There's not much that we do that isn't reported. And so they were raising the question is, should not-for-profits have large amounts of bank accounts? And then it sort of rhetorically raised the question is, if you're a not-for-profit and you have those bank accounts and charity care is down, should you be paying taxes? Are you still fulfilling your charitable mission and all of that? And it's a complicated conversation because all of us, we still have people that can't pay their bills that we give discounts to and write off and all that. But I think in this day and age with the expansion, it's a fair question to ask. Not an easy answer, but a fair question.
All right, now for the politics. Yeah. We have maybe three models looking at us in the ballot box.
Right.
We have Bernie Sanders talking single payer.
Right.
Hillary Clinton saying basically Affordable Care Act.
Right.
And Donald Trump saying not Affordable Care Act, I guess would be a fair way to characterize that. Do you feel a little nervous on, you don't know which way the wind will be blowing in a year?
Yeah, to be honest, I feel, I'm about really nervous, but I think it has all of our attention. Mm-hmm. I think that there's a couple pieces. Those are three very different solutions. I think I can't speak for Donald Trump literally, but the Republicans have, I don't know what the number is now, 45 or 50 times through the House voted to repeal Obamacare in total. Mm-hmm. They really haven't offered a whole lot of concrete suggestions, although I know Speaker Ryan is looking at some sort of tax credits and block grants for Medicaid. I think that Secretary Clinton would probably stick with some version of the current Affordable Care Act, Obamacare, and then Representative Sanders, or Senator Sanders, has been talking about a single-payer system for 25 years. And those are three very different things, how you fund it, how it happens. You know, it's a little bit, since it's our business, it's a little bit disconcerting to try to figure out where the political winds will go and how all of that works. And, you know, you get into the details of all of that. So,
well, the equation of where we are now going forward, it doesn't work. It doesn't add up. It's got to change.
Right.
So how that changes is the conversation
correct
that we need to have. Got some ideas on that?
Well, I mean, these would be my personal ideas. I wouwilliant want to represent Willamette Valley Medical Center, but I think there's a couple of things. I think the spirit of the Affordable Care Act makes sense. The idea of trying to get coverage to more people in this country. And as you and I talked earlier, I think that in the wealthiest country in the world, to have, pick your number, 45, 50, 55 million people that are either or underinsured just doesn't make sense. It's just not right. The question is, the devil's in the details. How do you do that? And I think in this country, we are very comfortable with choice, having lots of options. And so that sort of suggests that you're going to have some hybrid, I would think, of the current system of Blue Cross Blue Shield or whatever the insurance is, plus some government insurance, because there are always going to be people that can't get insurance for whatever reasons, disabled, for a variety of reasons, and they're just not going to get coverage. So you can't just let those people go uninsured. So my sense is there's a hybrid that you can find, whether it's as simple as the day you're born, everybody gets a government card, and that covers the absolute bare minimum, and then through your employer or personally, you're allowed to buy up, and that becomes the Blue Cross Blue Shields or the Cignas or something. I think we're going to have to look at some hybrid. The big question really becomes, it's not a great analogy, but think in terms of a car. You know, you can buy a car for $10,000 and a car for $100,000. They're going to both physically get you from point A to point B, but how they do that and what they do is completely different. And I think we're going to have a conversation in this country of what is the fundamentals of healthcare? What's the baseline? What's acceptable? And then how much are you willing to pay for that? Because right now it's highly subsidized, either by your employer, by the federal government, somehow. There are, not to suggest small numbers, but there are, the number of people that actually pay on their own completely, 100%, is not huge. Even though we pay more every day for it, I'm not to suggest we don't. Still, someplace in there, the vast majority of people have some kind of insurance that's partially paid for. So it's a complicated conversation, and the problem becomes, because it is healthcare, it's an emotional conversation. It affects you very deeply, very personally, and so it's harder to have, a real, sort of the adult intellectual conversation, because it's so personal, if that makes sense.
Mm-hmm, mm-hmm. Yeah, it's your body.
It's you.
Nothing more personal, yeah.
And we all have some horror story about either a medical experience or a bill. Mm-hmm. I don't know anybody that doesn't. I mean, I called my insurance company yesterday morning because I had a question about a bill, and I live in that world. It just didn't make sense.
You
So.
called your insurance.
Oh yeah, no, I just said you got to explain this to me.
Explain this to me.
But I think that's how
See.
complicated it is. I mean, how many
Uh-huh,
pieces of
uh-huh.
paper do you get in the mail about a bill?
Well, that says a lot. I feel a lot better now, Peter. That if you have to call out for an
Right,
explanation,
that's right.
I won't feel so. Well, we've just got a minute left
Okay.
here. You've been in the job now for how long?
Almost 2 years.
And what surprised you? What have you learned? What are you pleased about? What's a challenge? Just any of those questions.
Oh my
that
gosh!
stands out for
First
you.
off, it's an incredible organization, and I don't say that because I'm the CEO. It's just a really, really nice group of people. I mean, it's the physicians, the employees. They like what they do. They're happy. It's a really, really warm and embracing culture, and I think that is not just the hospital, but I think that's the community. This is a very comfortable and encouraging place to live. So I think that's been really a really pleasant. I don't want to say it's a surprise. It's been just a pleasant way to
Joy.
move and a joy to be here. So I think the only thing that's a surprise, and it's not really a surprise, is just how complicated healthcare is and what's going to happen next. It is scary. I mean, I don't mean to make your listeners nervous, but there's a lot of balls in the air right now as far as the financing and what this thing's going to look like.
All right. Well, thanks for coming here
Sure.
and helping us to understand a little bit more
Okay.
and putting a face to the hospital for those that are watching. And I'm feeling like I know the hospital a little bit better now. I was just over there the other day, but to hear that you are actively improving what's going on in the emergency room, customer service, it's just all good news. So thanks for being here.
Cool. Thanks for having me. It's a pleasure.